G'day. If you are post shoulder injury or surgery, a rotator cuff repair, supraspinatus tear, a shoulder impingement, shoulder mobility, frozen shoulder, or just overall range in your shoulders, even tightness, and you're trying to work out what is safe for you to do in the gym or in other movement areas, what does safe movement look like right now? This playlist is for you. I'm Steph. I am a clinical Pilates instructor. In this playlist, you'll see structured across the different videos, the different stages of recovery post-surgery through a shoulder repair. From early gentle movement, 10 weeks post-op, all the way to full strength and full load post-surgery recovery. If you're feeling like the swelling has gone down and you're ready to get into a little bit more movement, I'll encourage you to come to the online community to get a little bit more specific. When our progress post-surgery starts to slow down, just know you are not behind, and the right movement and rehab tools in order to recover the shoulder properly is what's going to be in this playlist. It means that you found this video at the right time. If you also know someone that's going through shoulder recovery and they want to get back into a little bit of movement, please send this their way, and I'll encourage to explore the rest of the channel, as there are all different parts of the body that we are going to clinically recover through the movement of Clinical Pilates. I hope you find what your body needs to keep showing up in your day today. I'll see you in there. Reformer time. We're going to start a bit left of field here and do some footwork on the foot bar very intentionally. What's happening up through that pain point, the shoulder point, is a little bit of pressure, and we're getting a lot of feedback from courage. How's that pressure feeling? Yeah. With the reformer as well, we can lift the headrest for a little bit more upright position. Nice. And in terms of sleeping postures, there are recommendations to sleep elevated. Obviously, when we're in one position for long periods of time, it's so important, especially on the point that we're recovering, not to lean on it, but the body has its ways, and sometimes, it needs to be comfortable to sleep as well. This is a great one for the tendon, which is so far away from the shoulder, but, as mentioned, that pain can work in diagonal. So yes, it's the left shoulder, it can come down to the right hip, the left knee, the right ankle, and vice versa, diagonal through the body. So symmetry through exercise is so important. Obviously, when the point of laying on that joint is not available, we take it mindfully. Good. We're going to do this for about 10 more seconds, and then we're going to get into a little bit of shoulder movement through resistance on the lightest spring ever. And when you're ready, you can just bring that carriage back down, take a bend through those knees, and I'll release some springs. This movement is pretty much what we're replicating, because when we pick up the straps, the carriage moves up and your legs will be elevated. Because of core, like legs in tabletop is fine, just try not to have them all the way out because it will just put too much pressure. So I'm going to give you the short straps, and you're pretty much going to be doing this but laying down with feedback. So it's just like another tool. It adds a little bit of resistance, but I'm talking like it's the lightest spring. If we have to take the spring off, we can do that as well. So I'm going to pull them down so you don't have to go overhead, and just grab a hold of the short ones for me. And now go legs into tabletop bar and press your palms down to the carriage, all the way down. Palm, yeah. So this is your reset button. So always come back to this because it's safe. One, because you're planted through the hands. Everything is in, a safe position. Your core will be on as well. Lucky you. And then we've got a half spring or yellow spring. Let's just start to lift up by 2 centimeters and then plant back down. See how that feels. Yeah. Inhale as the arms up, and then exhale, arms down. Good. Do you think you can do little circles for me next time you lift up? Good. And then let's go, little circles. So this replicates that exercise, right? So you can pause at any time. We're going to go other way in 3, in 2, and 1. Good. Internally rotate. Does it still feel easier? Good. Here for 10, 9, 8, 7, 6, 5, 4, 3, 2, and plant. Good. Hands come down. Good. Legs can just rest. They can either tuck in or they can find the platform here. We'll take legs up to tabletop. Good. And then we'll start our little angel arms. So just as wide as we can. Nice. And then squeeze those hands down by your side. Beautiful. Well done. Nice. But from this position here, like you can start to add on, we're not going to do it today, but your tricep extension, you can start doing, your dead bugs. So your arms can really move in that 360 motion, except for overhead, because we've got that feedback on the shoulder pads. But it's a really beautiful place to start, especially through anything shoulder related. Beautiful, Saran. Good. Feeling okay?
Yeah.
Nice. Inhale, exhale, squeeze. Good. Last 3 here. Nice. Last 2. Good. Last 1. Good. Keep your legs up. We're just going to take our hands in a dead bug position. So they will come straight in front of the chin. Yeah. Keep going if you can. That's it. Hold. Good. Feeling okay? I can release the straps whenever you need. Can we hold that dead bug there? Good. See how we've got that perfect 90-degree angle from the shoulder? Core is on, and so are the hips in this area. Dead bugs are straight out to the side. Just hold here, because this is a dead bug static hold. I don't want to challenge this posture too much today because I'm mindful of fatigue. Good. We're going to hold for 3, 2, 1. Good. I'm going to unwrap these straps. Just place your hands loosely on the body. Just recover. And whee, all the way back down. Nice. So that would probably be the, foundation of your clinical work at the moment. We are going to do one more in a seated position. How did that feel though?
Yeah, good. Just a little bit of tightness, pain. Maybe 1 out of 10.
Okay, good to know.
Which I think is acceptable.
Yeah.
Yeah.
And that's it. Little incremental is okay. You will find out a little bit more of how it liked it tomorrow as well. Like I would say even a day of complete rest and soothing bath, magnesium salts, all of that kind of really nourishing stuff tomorrow or even tonight. Okie dokie. And action. This is a seated posture. Again, there would be many exercises that we can use to progress, but we will get there. We're just treating this at a 10-week mark because it is, and very intentional. So it's on a yellow spring, so super light. I'm going to get you to grab, these are called a D-link, just pop a finger through there. And then other side as well. So left side, obviously I'm sitting on your left side. So it's just a small plough down by the sides and then back up. So automatically retracting the shoulder. I'm going to sit back here to not make you nervous, but just to see the shoulder and how if it's compensating. And you can start to progress this very easily. And I know that Serene's got a core of steel, but we can really make it either a back and shoulder exercise, or when we're starting to feel a little bit stronger in this posture, is leaning back into it like you're leaning on a recliner chair. Good, tuck the chin to chest. Good, see if you can lean back a little more. Beautiful. Feel any different? Core?
Yeah, more core.
Yeah, how's the shoulder?
It's fine. The shoulder's fine. So in here,
Yeah.
one point, just slight awareness of some tension, not pain.
Good. Moving really well. And you can start to really progress the exercise by lifting a leg, vice versa. Again, not today. We can have that fun a little bit later. Last 3. And then you can also progress through spring additional resistance. 2. Well done. Last 1. Beautiful. We're going to place those straps on the elbows. Have a little rest if you need. So we're going to use the longer straps. Nice. So automatically this is going to put tension through the rhomboids, the back. So I want you to close the book, lift the elbows as high as you can. This is important to guide. Yeah, I can already feel this left trap is fighting. So we are not going to take it too much more. If you can, breathe into that and just allow the shoulders to relax, before we move. Feel that difference? Good. And then open the book to read it. First page. We might even just go to the first page today. Let's go squeeze, squeeze here, squeeze here. Well done. And then close that book. Well done. How's that feeling? Good. And you can keep breathing into it. Tuck the chin. Try not to put the stress through your neck. Relaxing through where we're working. Wonderful.
Up again?
No. It's and that's the thing. It's not a baddie. It's not a bad muscle. Some muscles get a bad rap, but it can take over when we're trying to get into here. And I'm the queen of activating traps when they're not meant to be, because that's where I hold tension, and everybody's different. But especially when you've got a pain point around the shoulder, I can see your rear delts are turning on, which is perfect. Nice. Last 3 here. So good. Moving really well. So reason why I still did the open book exercise with Serene here, even though it was a little bit tight, it's a great exercise for her thoracic, and it is designed to help that rotation of the shoulder, where the supraspinatus tear actually limits the 0 to 15 degree movement. So this is a really great, perfect recovery rehab exercise to pair with a post-surgical recovery. If this session helped you or added to your already capable recovery regime, save it. Come back to it. And if you don't come back to this video, I will not take it personally, because I'll sleep well knowing that this clinical movement helps you recover and will always allow you to tune into your body when you need it. That means I've done my job. That's what this is all about, making clinical Pilates accessible to you from your own home. Rehab isn't just a one and done session. It's showing up again and again until your body creates that awareness and those mind to muscle connections that can change everything, even the way we're feeling. That's the whole idea. If you know someone who's going through a similar journey, a slip disc, a post-surgical recovery, or even just a pain point that they keep talking about, please pass this on. Life does throw us left and right sometimes, and these sessions are here for them too. If this is the content you want to keep seeing, or if you're moving through something specific, drop it in the comments. Subscribe or head to the online community where live sessions and clinical advice can become unique to your circumstances. I'm Steph Kenny, a dedicated clinical Pilates instructor, here to help you keep showing up in your body and in your day-to-day. Much love, and I'll see you in the next one.